Direct vasodilators. Direct vasodilators are not widely used now in outpatient settings, but you can see it more in the acute care settings. So they act directly on the arteriolar and or venous smooth muscle to cause relaxation. They do not work through the adrenergic receptors just like the other drugs that we previously discussed. Hydralazine is a direct vasodilator, so basically it directly works on the smooth muscles, so it relaxes it, causing vasodilation, which in turn will cause the blood pressure to go down and definitely making the afterload go down as well. Therapeutic effects include decrease in blood pressure by decreasing constriction, therefore decreasing PVR and decreasing afterload. Indications include hypertension, malignant uncontrollable hypertension, or hypertensive crisis. What is hypertensive crisis? So hypertensive crisis can manifest as either hypertensive urgency, which is usually a blood pressure greater than 180 over 110, or hypertensive emergency, which is a blood pressure greater than 180 over 120. And at the same time, in hypertensive emergency, the patient shows signs of end organ damage. So they're basically symptomatic. So they're having symptoms. And so if that's the case, this is considered a medical emergency. So patient needs to be instructed to proceed to the nearest emergency department or call 911 as it requires emergent medical treatment. Precautions include concurrent use of multiple drugs affecting blood pressure, especially this medication because of its hypotensive effect. Especially this medication can be given IV. Also, renal disease and stroke because of potential for severe hypotension. Contraindications include cerebral edema, because it can cause an increase in intracranial pressure, and acute MI. Side effects or adverse effects include headache, dizziness, and tachycardia. Nursing implications or nursing actions include assessment of heart rate and blood pressure, patient education which includes drug, the side effects, the blood pressure monitoring, hypotension symptoms, other drugs which may interact or affect, and examples of drugs in this class include hydralazine or apresilane.